Hi everybody, so we're going to cover chapter 5 on medical terminology. The basic components of a medical term are a compound of different words made up to make a whole word. The words are made up of roots that combine with a combining form, and then there's also prefixes and suffixes added into those. So you can see here in the example, thermo meaning a temperature, and a meter combining to make a thermometer. Or in the prefixes, you'll see these a lot of dis or tachy, those things like that, like tachy meaning fast, pnea meaning breathing or relating to breathing. So this could be dis meaning difficulty in breathing, and tachypnea meaning fast breathing. So here's another example of the word components. Tachy meaning fast. Cardia relates to the heart. So tachycardia meaning a fast heart rate. Another example, hemo meaning blood. Thorax meaning the chest. So hemothorax means that there's blood in the chest. Some more examples. Cardiologist. Cardio, as said before, relates to the heart. Ology means the study of, and ist is one who specializes in it, so cardiologist. An acronym, I think everybody's pretty familiar with what an acronym is, but there are numerous acronyms used in the EMS and first response world. So an example of an acronym for a medical device is CPAP, continuous positive airway pressure. Now, an abbreviation is very similar to an acronym, but the abbreviation is basically combining letters that you can't pronounce as a word, whereas CPAP being an acronym, that kind of makes a sound or a word, where a dinner, that doesn't really make any sense. So it's an abbreviation that you use to shorten up a phrase, like a DNR being a do not resuscitate. So don't be saying, well, we can't use the CPAP because they got a dinner. That doesn't really make any sense. So when and when not to use medical terms. When you're speaking to patients, don't be trying to baffle them with your brilliance. Don't be going out here saying big fancy medical lingo in front of them. Whenever you do, you're going to freak the patient out, and they're going to think because you said a big word that means that they have some form of rare, unhealable cancer or some weird disease that only 1 in 9 million people get. So use plain language when you're talking to patients to explain to them. Don't be telling them, well, I believe you're experiencing an episode of tachycardia. Tell them, it's like, well, it seems like your heart rate's up just a little bit. Simple things to the people who don't know medical terminology. Now, when you're dealing with medical staff, use medical terminology. As I've said before, if you look good, talk good, smell good, it makes you seem more competent. So use the medical terminology when dealing with EMS or other medical professionals.
Because the general public is now more aware of the proper use of medical terms, first responders will be expected to use more medical terminology. Many medical and anatomical words use roots, stems, suffixes, and prefixes to form new words. Some examples are cardio for heart, gastro for stomach, and pulmono for lungs. Knowing what the roots, stems, suffixes, and prefixes mean will help you quickly decipher new words that you are unfamiliar with. Let's look at an example. The prefix peri means to surround. Once you have peri to indicate that structure surrounds, add on the combining term for heart, cardio, and then the suffix ium to indicate a smaller portion of a larger system or structure. These elements form the medical term pericardium. Again, peri plus cardio plus ium equals pericardium, a sac that surrounds the heart. When medical personnel are speaking, it is difficult to stop, break apart, and decipher medical terms, but it will get easier with use. Practice will strengthen your abilities to understand and use correct medical terminology.
Now we'll talk a little bit on anatomy and physiology. So anatomy, basically just the study of the body structure, whereas physiology is a study of that body's functions. So when dealing with anatomy and physiology, you need to know the anatomical terms. So first, anatomical terms. The anatomic position is basically relayed as the person as if they were standing straight up, facing forward, hands at the sides, palms facing forward as well. And the body then is divided into planes. Midline, basically if you were to cut the body completely in half, starting at the head, going to the feet, that would be the midline of the body. So the term medial means closer to that midline, whereas lateral means further from the midline. Bilateral, meaning both sides. Say a patient has both their legs amputated. They have bilateral amputations. Unilateral, meaning on one side. And the mid-axillary line is a line that runs straight down the side. So if you were to basically cut from like the armpit all the way down the side, across your hip down, that is the mid-axillary line. Some additional directional terms. Anterior relates to the whole front of the body. So that person standing facing forward, their face, their belly, everything is the anterior part of their body. Posterior relates to the back side. So think about your posture, how straight your back is. So posterior relates to the back. Superior in a vertical aspect is anything above, and inferior is anything below. So think about superior, flexing your muscles, doing the Johnny Bravo, big flexing of the muscles, and inferior meaning below. As in old movies you've probably seen, people who were inferior to those were kissing their feet. So inferior meaning towards the feet, superior up towards the guns. Proximal means closer to the torso, whereas distal means further from the torso. Palmar, palm of the hand. Plantar is the sole of the foot. So you've probably heard of like plantar warts. People get those warts on the bottom of their feet. So here's some illustrations that help relay those directional terms. You see here, going proximal being closer towards the torso, distal being further away. So the shoulder is more proximal than the elbow, whereas the elbow is distal to the shoulder. Here's the midline. So straight down the middle of the body, cut it straight in half, is that midline. So just knowing that medial going towards that midline, where lateral is further away from it. And dorsal, top of the foot is kind of where it said you see over here, dorsal relating to the back too. Thinking about those dorsal fins on whales, dolphins, fish, everything on that back side, kind of on the arch. So mid-axillary, going straight through here, and then superior, anything above that, anything below that, along that mid-axillary line. So you see here, going from the armpit down. So superior, up here where the muscles are at, inferior, below, kissing on the feet. Then anterior, from that mid-axillary line towards the front, posterior towards the back. Other directional terms, we use some common terminology, so using the head, torso, and lower extremities of the legs, that's from the hip down. Upper extremities, the arms. So we use simple things, face, cranium within the head, mandible, meaning the jaw, neck, shoulders, arms, elbows, forearm, wrist, hand. Your thoracic cavity, and then your abdominal, and then your pelvis, and then thigh, knee, leg, ankle, foot. Pretty simple, basic terminology there. Now that mid-clavicular line defines, it's a little bit lateral to that midline. So the mid-clavicular line, think about your clavicle, your collarbone. So that's the line that starts at each collarbone and divides that chest into regions. So since there's two clavicles, there's two mid-clavicular lines. Some more illustrations here. The sagittal plane is that median plane, dividing that body to right and left. Frontal plane, that mid-axillary line, front and the back. The transverse plane, top and the bottom. So right there about the hips is where everything starts at the lower extremities. Now, abdominal quadrants divides your stomach into 4 areas. So imagine if there's a bullseye at your belly button. The crosshairs are right on the belly button. So you got your right upper, right lower, and left lower quadrants. See here in the illustration, the bullseye is right where that belly button would be. So in the right upper quadrant, remember the right and the left is always the patient's right and left, not yours. So right upper quadrant, you've got the liver, the kidneys, colon, pancreas, and the gallbladder. Right lower, mostly intestinal stuff, a little bit of the right kidney, colon, small intestines. You've got some major arteries and veins that run in through there, and as well as your appendix. Left upper is the liver, spleen, left kidney, stomach, colon, and pancreas. And the left lower is a little bit of the left kidney, colon, small intestines, major arteries and veins coming up from the left leg, and your ureters on both sides. Because your bladder kinda is right in the middle, right on the line. Now we'll talk about positional terms. Supine is the patient laying on their back. So the patient laying on their spine is in the supine position. Prone is a patient laying on their front side. Snipers lay in a prone position on their stomach, so that is the prone position. Recovery, laying on their side. So we talked about that's the recovery position for generally unconscious patients, stuff like that. Or you got that frat boy you're afraid it's going to throw up, they go in a recovery position. So here we go. Supine position, laying on the spine. Prone position, laying on the belly. Recovery position, laying on the side. And then the final two, the Fowler position. You have a high Fowler, which is a picture on the left, sitting straight up. The semi-Fowlers is laid back in kind of that lazy boy position.